So I'd like to invite our last speaker for this session, Julian Szafraniec. Right, I got it. Julian is a principal at SGS Economics and Planning and advocates for data-driven policy development as an economist to support efficient and sustainable communities and places. Julian aims to collaborate across a range of sectors, facilitating the exchange of ideas to understand the links and opportunities between them. He sees new data and technology as essential to how we understand and plan for our cities and regions in the future. Thanks, Julian.
Thanks, everyone. And it's been really amazing being at this conference over the last few days. It's been so many inspiring speeches that we've seen over the last couple of days. So I'm going to be talking about SGS Cities and Regions Wellbeing Index, which we've done for 2 years now. And this measure takes an objective approach, and it tries to do similar to what we heard in the previous presentation, which is bring some of these research down to a community scale. Sweet. Oh, I think I'm the first one where it worked straight off. But before we get into this, I did want to acknowledge the traditional owners of the land, so the Ngunnawal and Ngambri people. And I really think that it's really important to this conference that we learn a lot from this rich and unique culture and the history that it has in Australia. And I was really inspired and truly kind of had so many ideas from Phil's speech yesterday, and I think there's so much we can take from that culture and history into this space. So what I'm talking to you about today is, first I'm going to take you through a little bit about why we created another index. I know there's a lot of research in this space, but what did we see as a role that another index could play in here? Then I'm going to talk you through a little bit about the results that we came from the SGS Cities and Regions Index and this release. And then finally, I'll talk a little bit about what we've learned from creating the index and where we want to take it to next. So one of the key reasons why we self-funded this work really goes to who SGS is as a business. And SGS isn't a traditional consulting firm. We're actually an entirely employee-owned, equal equity, for-purpose cooperative. So we're like one of those firms that Catherine from Wheel was talking about. We're trying to chart a different path around how we provide public policy and balance both financial sustainability with a purpose-based mission in our work. And we do a lot of work across government, with local government, with state government, with federal government, around all range of issues, around strategies, policies, community infrastructure planning, and business cases. And through all of that work, we often see a need to engage in the policy life cycle in a different way. And really, well-being is at the core of these values and why government needs to make these decisions in a different way. And that's what we've heard time and time again throughout this conference. And we're a mixture of planners, data scientists, and economists, welfare economists. And so it's those skills coming together where we really think that this needs to come down to a place-based scale. So we've seen this story around GDP told a number of times throughout the conference. Aside from a few blips, GDP has grown strongly over the past 100 decades. Australia is the lucky country. But we know that there's a problem with GDP as a measure of progress. But that aside, SGS over the last 10 years has actually broken GDP down to a local community scale, so an LGA scale. And what we've seen there is that even GDP is not distributed evenly, and where you live in Australia determines even how much access you get to the economy. And we've seen 60% of economic growth is concentrated in the capital city, the 5 biggest capital cities, and most of that goes into the core of those capital cities as well. That's part of the structure of the economy that's changed. And there's spatial inequalities that occur as a result of that, depending on where you live in the country. But everything we've heard about from the conference today really says that this doesn't tell the full picture. And I find it really frustrating when I'm working with different people in the public policy space, looking at investment or creating strategies. And I see strategies sometimes like this, where the focus is wrong. The targets are wrong on what they're aiming for. They're focusing on jobs, economic growth, and not really thinking about what type of growth that is, rather than really how can we improve people's lives? What are those things that matter most? And what I wanted to do was try and connect some of the research and the work that's happening at a national scale, at a global scale, with those local communities that are trying to do these various documents. And so we need to change how we measure success and progress, and we've seen this throughout the conference as well. Now, I want to break this down a little bit so that you understand where our work maybe fits in. So wellbeing, as we know, is personal in its core, and it's a combination of both individual characteristics, so things such as my age and ethnicity, my values on life, and also place characteristics, so housing, access to public transport, other things like that. And there's two broad approaches that we can think about in terms of measuring wellbeing. So subjective approaches, which really do get to the core of wellbeing. So they measure how you as a person feel, and they're generally done through surveys, and there's a lot of work around that. There's also objective approaches, which focus more on the factors of a place, and the characteristics that can influence a person's well-being. It's often these factors that are the things that government can influence, where to place a school, a dental surgery, as we heard from the previous speaker, where to put a hospital, a train line, and these things can influence those external factors of well-being for a community. Composite measures then can bring those two things together, such as the Measuring What Matters index does. Now, these measures can influence policy and investment decisions and that wellbeing economy that we've heard about. So wellbeing, if we put it at the heart of the public policy life cycle, can impact it at all stages, from understanding where issues are most needed, where intervention is most needed and setting the agenda, helping formulate those public policy responses, and then communicating why they're needed and finding out how they were implemented, monitoring and evaluation over time. So with that context in mind, I wanted to talk about where we're trying to get the SGS Cities and Regions Wellbeing Index to fit in. So what we saw is that there's amazing research that understands a lot of these issues, but often it's at a population-wide scale or at a regional scale. And it doesn't come down to a local community. Other times what we see is local communities doing surveys for their particular area, and they're not understanding how that community fits within the broader context. Are they doing better or worse compared to their neighbours or other growth area councils or regional councils? So what we tried to do is create a community, a local community scale that's national in coverage, and focuses on those community level or objective data variables that impact wellbeing for the community. So it doesn't tell the full picture, it doesn't get down to a personal wellbeing scale, but hopefully it provides new information that can bridge some of those gaps in that broader public policy space. So our framework here includes 7 dimensions, which would be broadly similar or familiar to a lot of the other frameworks that we've seen throughout the conference. So it includes economy, strong, productive and diverse local economies. So I think the economy is still relevant at a community scale. If you don't have access to jobs, if you don't have access to services, that is a relevant factor at a community scale. Income and wealth, so the affordability of community. Do they have greater security, greater stability? Education and skills, so higher education levels, engagement in the workforce, that can support social mobility and provide financial and broader satisfaction. Housing, and housing here really focuses on affordability. So do you have access to affordable rental accommodation? Is there homelessness issues? Is there overcrowding? Health. is there access to health prevention, primary and acute health services? Balance, and is there balance in the community, where successes are shared and given back. There's a typo there, I see, back to the community. And environment really focuses on protecting biodiversity and reducing climate risk. So far, we've managed to collect 24 indicators across these 7 dimensions, across all LGAs at a national scale. So this is our second release, and we're hoping to update this on an annual basis and add more information to this over time. So in the economic domain, it includes things such as traditional measures, such as gross regional product of that local community, but it also includes economic diversity. Is that just based on one single sector, or do they have a broad range of businesses occurring in that area? Around income and wealth, we've included measures such as home equity at the moment as a proxy for wealth in that local community, and in housing, things such as rental affordability. In balance, we've considered things such as income inequality, gender pay gaps, levels of volunteer rates, and gender domestic work pay gaps as well. So what did we find from this second release? So here's another dashboard that we've produced here as well that is freely available and provides this information across all of the data. There's a map view as well as an information view where you can look at a particular local government and see all the relevant data for that particular council. You can also look at the headline wellbeing index as well as each of the dimensions and adjust the weightings for each of those dimensions. And what we've found really is where you live in Australia does influence your well-being, does influence these factors and can impact your well-being. At a headline, what we did find is that there is a divide between the capital cities and rest of the country. And those capital cities on average scored higher across most of the wellbeing domains, but not all of them. But what I think once you break it down to a smaller scale is that it's actually where you live in those capital cities or where you live in those regional centres that actually matters more. If you take, say, New South Wales, where you live in Sydney is actually much more important than whether you live in Sydney or whether you live in regional New South Wales. There's many places in regional New South Wales that scored much higher than some parts of Sydney. There's many places in Sydney, such as within some of the western suburbs, that scored much lower than places in regional New South Wales. And so that's why it's really important to break these measures down to a local scale. And we saw that this varied by different dimensions. So one of the ones that was most polarised by the capital city regional divide was health. And we saw that talked about in a number of presentations throughout the conference. And then we saw measures such as balance or housing affordability being actually more evenly spread across cities and regions. And so this is one example of a place where they didn't actually score very strongly around economic and wealth type indicators, but they scored higher around balance, housing, the environment. They had higher rates of volunteerism, lower gender pay gaps, and general income inequality. And they had people working less hours. And this really shows some communities charting an alternative pathway to success, and something that those communities can be proud of and engage of, even though they don't have strengths around economic outcomes. This year, we also dove into issues around gender equality in a bit more detail, and we included a number of indicators around that. And while we found that the majority of LGAs actually performed well on workforce participation pay gap, there's a larger gap still that persists around unpaid work, with females doing roughly double that of their male counterparts. And what was interesting is that this gap existed both in cities and in regional areas, so it wasn't highly correlated to one or the other. We also saw that while there is improvements in gender pay gaps, this had varying levels across cities and regions, and it was really the worst in some of those remote communities that relied on extractive industries, mining communities, things like that. In those areas where those pay gaps were most significant. We also saw that was correlated with also the domestic work gap and other factors around volunteerism and other measures that saw that they had relatively low scores on wellbeing overall as well. Another area that we looked at was the relationship between housing and wellbeing being a very, topical issue right at the moment. And what we found here is that most LGAs within 100 kilometres of major cities, so that's the blue dots on the left side of the chart, were generally at least moderately unaffordable, typically a lot worse within those centres. And as you move further away into those regional areas, you became more affordable for most states, but that wasn't always the case. Exceptions like Queensland, Tasmania and Victoria, where you move further away from those capital cities and you still don't become affordable. And this is really due to either housing constraints and also tourist towns where we've got short-term accommodation and other factors like that that's really constraining affordability within those communities, and lower incomes as well contributing to that, meaning that the affordability crisis is quite wide-ranging. We did also see that there was a relationship between unaffordability and some of the domains, particularly around economy, skills and health in particular. And this really highlighted that people are making trade-offs around this housing affordability crisis. And they're trying to get into those suburbs that do have greater access to those things. And it's not simply about providing more housing anywhere, it's really about providing houses in the right location, and that's what this can try and highlight. So what did we learn from this release so far? So we've only done it for 2 years now. We want to do it further in the future. So I wanted to share some of the learnings from this so far. So first off, maybe we're a bit too ambitious, bit too naive about getting access to publicly available data. I've worked in the economic space and there seems like there's so much data available to us all the time that I thought that we would be able to track a lot of these dimensions through various indicators. That wasn't the case. It's been an incredible challenge, I would say, and getting more access, as we heard from the previous speaker, to this data in the public domain is really important. So currently most of the indicators are based off ABS sources that are publicly available, either derived or direct. We've still got probably gaps in our index around environment and health in particular. And we want to include a new dimension around connectivity to include the transport and digital connectivity. There's a lot of work that went into it around data cleaning, removing outliers, small sample sizes, normalizing the indicators, but I won't go into that. But one thing I did want to just briefly touch on was providing a simple entry point to the data. I think us in this conference, and it's been amazing being here, can understand a lot of the complexity, but I find when I'm talking to a new councillor, a new state person, a new government, a local council, that they need a simple entry point into this. And that's one thing that GDP actually has going for it. It's, for all its downsides, it can boil down a very complex market-based economy into a single number. And so I think sometimes, we need to try and simplify this wellbeing concept and frameworks into some sort of simple way that we can give an entry point to many people into the conversation. So I think that there is benefit of providing a composite index as long as people can then see the detail below that. So that's what we've tried to do with our index, is weight those different domains and bring them together. But I'll also say that, I don't think we got it quite right so far, and you don't want that to be the end point. And so we did include in our report at page 20-something a ranking table where we showed the top 10, bottom 10 LGAs. And when we released it, the media really jumped on that. And, it was really hard to progress the conversation beyond that, even though in a lot of other forums we saw that progressed. So it's a balancing act, and I think now we're trying to shift to creating new data visualizations to try and show that balance. And what I'm trying to say is that I think, you know, to get this research out and to give it impact, we really need to find ways to actually visualize and get people engaged with the analysis as well. So I'll end it here and just say, you know, what's next? I think we're only at the beginning of our journey in terms of this space. And, you know, I don't think there's a single correct framework, ours or others, and we want to try and bridge a gap within the public policy space around this. So what we see this indices role is really bridging that gap between some of the national and wider research and bringing it down to a community scale. Hopefully over time we can bring in more data sets that become accessible, bring in different population lenses, and also bring in information around some of the subjective wellbeing research as well. So if you want to check out the dashboard, you can scan that QR code, but also happy to answer questions now as well. Thank you.